Star Naomi Osaka withdrew from the French Open after revealing she has had long bouts of depression and anxiety since her first Grand Slam win in 2018, tweeting that she never wanted to be a distraction at the French Open. With Mental Health Awareness Month just concluding, we wanted to take one more look at mental health, the warning signs, and how you can help someone who may be suffering from mental illness. I'm joined now by ABC-7 at 4 medical contributor Dr. Neha Sharma. She's medical director of the Hospitals of Providence Northeast and Horizon City. Dr. Sharma, how does Osaka's decision highlight the importance of mental health awareness?
First of all, she's not alone. I applaud her for choosing her well-being over everything and prioritizing self-care. But the response to her statement further illuminates the importance of mental health awareness, and it also exposes the lack of mental health support, which is what we really need. In spite of all the awareness-raising efforts, stigma and mistrust are key reasons people don't seek treatment for mental health conditions.
How common are mental illnesses, Dr. Sharma?
Mental health conditions are among the most common health conditions in the United States. More than 50% will be diagnosed with a mental illness in their lifetime, and 1 in 5 Americans will experience a mental illness in a given year. And the most common mental health conditions are anxiety disorders, and suicide is the second leading cause of death in people aged 10 to 34 in the United States.
So what are some warning signs for mental illness?
Each illness has its own symptoms, but some common warning signs to look out for include excessive worrying or fear, feeling excessively low or sad, losing interest in normal activities or things you typically enjoy, problems concentrating, mood changes, and changes in eating and sleeping habits.
Now, this is most important here. If someone's suffering from a mental health condition, what should they do?
Firstly, do not be afraid to reach out if you or someone you know needs help. A healthcare provider can help you develop a treatment plan, and that can include anything from medications, therapy, and lifestyle changes. But I think it goes beyond that. We need a cultural change as a society. It's time that we stop questioning the validity of someone's struggle with their mental health. The stigma that surrounds it all was on display this week. Even a powerful athlete can be subjected to the pressure of not having their mental health supported. This highlights how difficult it must be for individuals with limited resources to advocate for their mental health. I want everyone to know that it is okay to talk about your mental health without any shame. And as a society, we need to trust and we need to believe. And we also need to create a safe space that allows for flexibility that accounts for all ebbs and flows.
ABC-7 at 4 medical contributor Dr. Neha Sharma, as always, thanks for your time.
Thank you, Mark.